A heart murmur is an extra, unusual sound in your heartbeat. Ordinarily, you would hear what is referred to as a lub-dub sound. The first S1 sound is due to the closure of the mitral and tricuspid valves as the ventricular pressures exceed arterial pressures at the beginning of systole. The S2 sound is caused by that of the semilunar valves, also known as the aortic and pulmonary valves. Between S1 and S2 is known as systole, and between S2 to S1 is known as diastole. This is what a normal, healthy heartbeat should sound like. There are a number of issues that can occur with the heart, and being able to hear those differences in something as simple as an auscultation can help to narrow down the diagnosis. We're going to be covering some of the more common heart defects that can occur, and what one should be looking out for. Mitral stenosis is the narrowing of the valve between the two left heart chambers. The narrowed valve reduces or blocks blood flow into the heart's main pumping chamber. The most common cause of this is rheumatic fever. Mitral stenosis leads to the S1 being louder than normal. There is also an opening snap, an early diastolic high-pitched sound. In addition, there is a faint mid to late diastolic murmur which is best heard during expiration. You will also notice a low volume pulse. Mitral regurgitation occurs when blood leaks back through the mitral valve on systole and is the second most common valve disease after aortic stenosis. This results in pansystolic or hollow systolic murmurs, which means that a continuous noise is heard between S1 and S2, noted to be blowing in character. S1 is often quiet as a result of incomplete closure of the valves. Severe mitral regurgitation can also cause a widely split S2. The S2 normally has two audible components, termed the A2 and the P2. These are virtually single on expiration, but the aortic valve closes slightly sooner than the pulmonary valve on expiration. Aortic stenosis is the most common type of heart defect. It leads to what is known as an ejection systolic murmur or a crescendo-decrescendo systolic murmur, owing to the rise and fall of the sound noted. The S2 is soft or even absent in certain cases. It gives rise to a distinctive S4 sound just before the S1, which is often described as an atrial gallop. It also leads to a narrow pulse pressure, where one's pulse pressure is 1/4 or less of their usual systolic pressure. There is also a slow rising pulse, involving a delayed upstroke. Aortic regurgitation is the leaking of the aortic valve, causing blood flow in the reverse direction during ventricular diastole. It leads to an early diastolic murmur, the intensity of which is often increased when the patient grips their hand. It leads to a collapsing pulse and a wide pulse pressure. In severe aortic regurgitation, also known as an Austin-Flint murmur, the murmur heard is instead a mid-diastolic one. Patent ductus arteriosus is a persistent opening between the two major blood vessels leading from the heart. The opening, the ductus arteriosus, is a normal part of a baby's circulatory system in the womb that usually closes shortly after birth. If it remains opened, it's called a patent ductus arteriosus. This leads to a distinctive continuous machinery murmur on auscultation with a bounding, collapsing pulse. It is noted also by a wide pulse pressure and a left subclavicular frill. These are some of the most common defects observed. As a quick recap, aortic stenosis leads to an ejection systolic murmur and a soft S2. Mitral regurgitation leads to a pansystolic murmur, a soft S1, and on occasion, a widely split S2. Aortic regurgitation leads to an early diastolic murmur. Mitral stenosis leads to a mid to late diastolic murmur, an opening snap, and a loud S1. A patent ductus arteriosus leads to a continuous machinery murmur. Hypertrophic obstructive cardiomyopathy is an autosomal dominant disorder in which the heart muscle cells enlarge and the walls of the heart chambers thicken. The heart chambers are reduced in size, reducing total blood volume. The walls cannot relax properly and may stiffen, which in turn can obstruct the flow of blood. This typically leads to an ejection systolic murmur. Please note that this has been anything but an exhaustive list of the different heart murmurs. Hopefully, however, it has given you a brief insight into the major ones that exist and what one can expect to hear. That's all from me. Thank you very much for watching.